Conception to Delivery, Pregnancy Journey. Hello and welcome to our video on the journey through pregnancy, from conception to delivery. Throughout this video, we'll explore the amazing process of pregnancy and the development of a new life, providing you with week-by-week updates. Understanding the stages of pregnancy is important for expecting parents, as it allows you to better care for both the mother and the developing baby. Weeks 1 to 2, Conception. Process of conception. The incredible journey of pregnancy begins with conception. Each month, a woman's body releases an egg during ovulation. Once released, the egg travels down the fallopian tube, where it may be fertilized by a sperm cell. Sperm and egg fertilization. If a sperm cell successfully penetrates the egg, fertilization occurs. At this point, the fertilized egg, now called a zygote, begins to divide and multiply rapidly, forming a cluster of cells. Early embryonic development. Over the next few days, the zygote will travel down the fallopian tube and into the uterus. As it does so, it continues to divide and develop, transitioning into a blastocyst, which will eventually implant itself into the uterus and develop into an embryo. Weeks 3 to 4, Implantation and early development. Implantation and placenta. During weeks 3 and 4, the blastocyst implants itself into the lumen and uterus, where it will continue to grow and develop. As it does so, the placenta begins to form, which will provide nourishment and oxygen to the developing baby. Amniotic sac and umbilical cord. At the same time, the amniotic sac starts to form, eventually enclosing the embryo in a protective environment filled with amniotic fluid. The umbilical cord also develops, connecting the baby to the placenta and serving as the lifeline for exchanging nutrients and waste products. Embryonic period and organ development. The embryonic period begins at this stage and continues until the end of the 10th week. During this crucial time, the baby's major organs, such as the heart, brain, and spinal cord, start to form, setting the foundation for future growth and development. Weeks 5 to 8, First Trimester Development. Physical changes in the mother. During the first trimester, the mother may not notice significant physical changes. However, internally, the uterus is expanding, and hormonal changes are taking place to support the pregnancy. Fetal development milestones. During weeks 5 to 8, the baby undergoes rapid growth and development. Young buds emerge, the heart begins to beat, and the brain and spinal cord continue to develop. Common pregnancy symptoms. First trimester symptoms often include morning sickness, fatigue, breast tenderness, and enforced urination. These symptoms are the result of hormonal changes and usually subside as the pregnancy progresses. Weeks 9 to 13, Second trimester development. Physical changes in the mother. As the second trimester begins, the mother may notice her belly gradually expanding. This is due to the continued growth of the baby and the uterus. Fetal development milestones. During weeks 9 to 13, the baby's facial features become more defined, fingerprints develop, and the baby starts to grow rapidly. The baby's movements may also become more noticeable. Common pregnancy symptoms. During the second trimester, many women experience a reduction in morning sickness and an increase in energy levels. This is often considered the most comfortable stage of pregnancy, as the mother's body adjusts to the changes. Weeks 14 to 27, Second trimester development continue. Fetal movement. Between weeks 14 and 27, the baby's movements become more frequent and pronounced. These movements, also known as quickening, are initially subtle and may feel like flutters or gas bubbles, but they will become stronger and more distinct over time. Fetal hearing development. During this period, the baby's hearing also develops. The baby can start to recognize and respond to sounds, including the mother's voice and external noises. 20-week anatomy scan. Around the 20th week of pregnancy, the mother will typically undergo an anatomy scan. This detailed ultrasound provides a closer look at the baby's development, checking for any potential issues and confirming the baby's sex, if desired. Weeks 28 to 40, Third trimester development. Physical changes in the mother. As the mother enters the third trimester, she will experience continued physical belly will grow larger, and she may experience shortness of breath, swollen feet, and back aches. Fetal development milestones. During weeks 28 to 40, the baby's lungs mature, fat accumulates under the skin, and brain development accelerates. The baby also begins to prepare for birth by moving into a head-down position. Common pregnancy symptoms. In the third trimester, women may experience Braxton Hicks contractions, which are practice contractions that help prepare the body for labor. Other symptoms include difficulty sleeping, heartburn, and increased frequency of urination. Weeks 37 to 40, preparing for birth. Signs of labor. As the mother approaches her due date, it's essential to recognize the signs of labor, which include contractions, the water breaking, and a bloody show, which is a mucus discharge mixed with blood. Stages of labor. Labor consists of several stages, including early labor, active labor, transition, pushing, and delivery. Each stage presents its challenges and progress indicators. Potential interventions. During labor, various interventions may be necessary to ensure the safety of both the mother and the baby. These can include pain relief options, such as epidurals, and cesarean sections in case of complications. We've discussed the developmental milestones, physical changes in the mother, and common pregnancy symptoms. Encourage prenatal care. Prenatal care and education are essential for the well-being of both the mother and the baby. We encourage all expecting parents to consult with healthcare professionals for personalized advice and support. Thank you for watching, and please feel free to share your thoughts and questions in the comments section below.